Just when we thought the experiments like the Tuskegee experiment of 1932 were a thing of the past, now we have the 2026 Guinea-Bissau study. The unethical practices of the past are still here. It is unethical to withhold a proven and effective treatment in a study intentionally. And this study was being conducted by yet again another U.S. researcher, because once again, the U.S. government has a long history of unethical practices, especially internationally, and especially when it comes to brown and black communities. It is important that someone's poverty is not weaponized for the gain of medical research. For many of you, the Tuskegee experiment represents what is the symbolism or became the symbolic experiment that demonstrates the historical reasons why African Americans do not trust the healthcare system in America, specifically when it comes to research. The Tuskegee experiment is oftentimes referenced as the key experiment that exemplifies the distrust between the healthcare system and African Americans, as that study demonstrated that the healthcare system is not to be trusted. And while there have been lots of setbacks and other examples, such as the maternal mortality in the US when it comes to Black women, there has been some hope that experiments like the Tuskegee experiment will not happen again, and that we have created safety barriers to prevent such exploitation when it comes to medical research. Until now. Before we travel down memory lane and discuss the Tuskegee experiment, just to refresh your memory, I want to welcome all those who are visiting our platform for the very first time. If you haven't done so already, I want to remind you to go ahead and hit that subscribe button, give us a thumbs up, and go ahead and click that notification button so that you know every time we drop a new episode or a new short that is raising your awareness of what's going on in the healthcare, not just in the US, but internationally. Now, let's get back to that Tuskegee experiment. If you haven't heard, there has been a very concerning study that was proposed to be conducted in the country of Guinea-Bissau, Africa. Let me explain why this study is of such great international concern. Before we get into the new study of the infants in Guinea-Bissau, and as I explained why this particular study is of great importance because it was funded by the CDC of America, and maybe an implication of potential other studies to come, or at least under this particular context. Let's go backwards in time for just a quick moment so that we can all be on the same page when it comes to the Tuskegee experiment. The Tuskegee experiment was conducted starting in 1932 by the U.S. Public Health Service. Now, the goal of the experiment was to look at the progression of having syphilis. The problem with the construct of the study or the design of the study, they recruited 600 men, specifically Black men, from Macon County, Alabama, and they gave them the impression that the study was looking at the outcomes of having bad blood. Now, at that time in the 1930s, bad blood was used as a term to represent a variety of diseases. So it was not disclosed to the men that they were being studied specifically for syphilis. By 1947, penicillin became a recommended standard of treating syphilis. The men were not informed. Most of them were sharecroppers. They were not informed of what the study was about, nor were they offered treatment for syphilis. In fact, the treatment was withheld intentionally so that the researchers can gather the data they wanted in terms of looking at the outcomes. Now, we know that syphilis is potentially deadly if it's untreated. It has a number of serious complications, including neurosyphilis, which can be extremely devastating. Not only that, but one of the things that's not discussed is just the progression of the disease from an epidemiological perspective. So not only were these men not treated for, at that time, a very treatable condition, but they also were allowed to continue to spread the disease among the community. So this was an insult beyond just the individual, but on the community at large. And both were equally devastating. Now, the study ended in 1972 once it became known that this unethical practice was being done as a part of this particular study. So between 1947 and 1972, the men were not offered proper treatment. Now, unfortunately, this was not the last study when it comes to unethical practices by the Public Health Service Department of the United States government. You also have the concerning studies that were done on birth control in Puerto Rico. You have the eugenics practices in the United States in several states, including California. You have also the Guatemalan study, which very many people do not talk about. So whereas in the Tuskegee experiment, the men already had the infection, but the um, known treatment was withheld. In the Guatemalan study, they were actually infected with sexually transmitted infections. Now, the Guatemalan study was conducted in the 1940s and was conducted by a physician who also participated in the Tuskegee experiment. Now, with the Guatemalan study of importance, what they did in that study was that they actually infected the participants with three sexually transmitted infections. The participants were infected with syphilis, chancroid, and gonorrhea. The participants included over 1,300 Guatemalan soldiers, hospital patients, prisoners, and sex workers. They were not informed that they were being infected with these three sexually transmitted infections. There were so many layers of unethical practices in this study. First, the researchers paid sex workers to infect participants with the infections. And when that didn't work, they then proceeded to inject the participants with the infections. It was not until 2010 that the Guatemalan government received a formal apology from the US government under the leadership of then President Barack Obama for the work that was done in the 1940s. Now let's fast forward to 2026, and the same unethical practices yet continue. Let's talk about the study of Guinea-Bissau and the Danish researchers. So the Danish researchers received $1.6 million in funding to conduct a study in Guinea-Bissau. Why Guinea-Bissau? Well, one, it's one of the poorest nations, so having funding, I'm sure, was compelling for the government to participate. Two, Guinea-Bissau has a high prevalence of hepatitis B, and I'm sure that's probably one of the reasons why the researchers selected or targeted this particular country. The Danish researchers' goals were to recruit or enroll 14,000 infants. And the goal was to do a comparison study where one group would receive the hepatitis B vaccine at birth, which is the current recommendation under the World Health Organization. And then the other group would receive a delayed administration of the vaccine at 6 weeks of age. Now, what makes this study so unethical is the fact that we know that giving hepatitis B vaccine at birth has tremendous benefits for the infants and is very effective in preventing short-term and long-term adverse outcomes from hepatitis B. We also know already that studies have shown that infants who receive the hepatitis B vaccine based on the current guidelines of the World Health Organization have shown a decrease in all-cause mortality, meaning overall their lifespan and their survival is benefited by having the vaccine, not just the prevention of the hepatitis B infection. They said their goal was to look at potential additional benefits of the vaccine beyond just the immunization against the hepatitis B virus. Now, why is the study being compared to the Tuskegee experiment? There has not been transparency with regards to what the consent looks like for participants, meaning how much are they informed about the guidelines of the WHO and about the intent of the study. And then not much clarity was received in terms of what happens if an infant was to become infected with hepatitis B. Who's paying the bills? Because of that, this study has garnered international outrage. For the most obvious reason, it is unethical to withhold a proven and effective treatment in a study intentionally. No study should be done on any participant when there is a known effective treatment or remedy or even cure, and that treatment option is withheld from participants, essentially knowing that there's a high likelihood that those who do not receive the intervention will have some adverse outcome. That is extremely unethical, and that is why this study is currently on hold. So I brought this study up to remind us that while we feel that we are so far removed from the Tuskegee experiment of 1932, this new experiment that was proposed for Guinea-Bissau reminds us that we are not that far removed. And the fact that the US government was the source of the funding of the study is even more concerning. Because once again, the US government has a long history of unethical practices, especially internationally, and especially when it comes to Brown and Black communities. And this is why this continues to feed into the ongoing distrust between Black and Brown communities and US researchers, because there's once again proof that there is a lack of consideration when it comes to the ethics of these studies. It's also a reminder that we can make the difference. Because of the outrage that this study received, it is currently on hold. Now, we got to keep our eyes and our ears to the streets to make sure that it remains on hold until these unethical practices are fixed. And it's also important that the participants in Guinea-Bissau are aware of why the international community is concerned. It is important that someone's poverty is not weaponized for the gain of medical research. That is, in fact, the greatest unethical practice that any researcher can do. It's important that we continue to pay attention to these studies, as there's now a new concern for a study that was being done in Honduras, in which pregnant women were undergoing a study they had no idea. And this study was being conducted by yet again another US researcher. So, in the recent release of the famous files that everyone's been waiting for, the Ep files revealed that a Yale professor was, in fact, I don't know if I need to say allegedly, but I'm going to say allegedly, conducting a study and was communicating with Epstein with regards to the study. This study was to look at how social networks are to help improve maternal outcomes. Now, this study, once again, was being conducted over 10 years in 176 low-income communities in Honduras. According to the emails, they were encouraging large-scale behavioral changes and looking at issues such as breastfeeding, prenatal care, and diarrhea treatment. The problem is that the members of these communities had no idea that they were being included in these studies, allegedly. The unethical practices of the past are still here, and they're still targeting the low-income communities, meaning they are weaponizing the poverty of these communities for their own personal research gain. It is important for us to keep our ears and our eyes forward to pay attention to what even our governments are going into agreements with so that we can make sure to protect our Black and Brown communities from these unethical practices. It is important for Black and Brown communities to participate in research, but it's imperative that we are given consent, informed consent, meaning we know exactly what the researchers are doing, what their intentions are, and that there is some level of supervision to protect our communities. It is imperative that we are able to gain some level of trust when it comes to research, because the lack of participation in research is not only justified, but it is unfortunately harming our communities, because the lack of participation and representation in research prevents us from understanding how we are affected by different disorders and how different treatment options affect us so that we can determine what is best for our communities. So I hope I've enlightened you to what is an ongoing problem when it comes to research, specifically medical research in our communities, not just in the US, but also internationally. This is Dr. T, and I'm the hand behind the handle of Healthy Bump Club right here on YouTube and healthybump.club on Instagram. Thank you guys for joining us today, and hope to see you guys when the next episode. This is Dr. T, just a friendly reminder, don't forget to comment, like, and share, and go ahead, why not, click that subscribe button, help us to get to the next 1,000 subscribers. We thank you guys for supporting.